The front tooth, I had the accident.
Right,
where
yeah.
I was trying to catch the cat and then I fell
And,
down.
and you fell down, I see.
And then, because it's cosmetic, one of the Chinese doctor made it.
It's all right.
So it just comes out.
Patient has been referred to me by her dentist for specialist evaluation because in the past she's seen many dentists who have placed different type of restorations, and with time, you know, the errors or mistakes tend to multiply. Each one follows the same analysis mistake, and so she's got now a smile that's sticking out that way, and she can't put her lips together, and she's quite bubbly and quite funny. When most people will be very upset about the condition they're in, but she was, you know, had enough, more than enough sense of humor to see the funny part of it. We had a good laugh. So initially, you can see on the images how she's showing the unevenness of the smile. The center lines are out, teeth are everywhere. Not only the teeth are everywhere, but the arrangement of the smile line is totally out of proportion. It looks totally unnatural. The color is not natural, it's very discolored. Teeth are very crooked. She's got a wide smile line. She's got a complex smile line. And when you have a complex smile line, what I mean by that is that your top and bottom teeth are all on the show. Your gums are showing. So you cannot make a mistake, you can't hide things. And also the fact that some of the teeth on the upper left side are failing. And some of the slides you can see that these teeth are removed and we have a huge defect on the left side of the upper jaw. So having a wide smile line and a complex arch form, it makes life extremely difficult to restore these. But with today's technology of grafting, and with myself having dual qualification of implant surgery, grafting, as well as reconstructive dentistry as a specialty, it helps me to help the patient in formulating the best treatment and you know, based on my initial diagnosis. So we took lots of X-rays and CAT scans, and took the models, did lots of diagnostics, the initial diagnostic mock-up for this patient to see how it's going to look. You can see in the next few slides how the protruding, and I was procline her front teeth were. She couldn't make a seal with the lips, and she had a lisping sound. The patient was so concerned about recent dental treatment that made her front teeth proclined. And this proclining front teeth as well as the canting of the upper smile line. And the whole arrangement was just not right. She was very upset. Again, being upset is one thing, but she was able to contain that, you know, with a sense of humor. So here we are, you know, and we did the diagnosis for the patient. We improved the initial diagnosis by, we couldn't actually aid anything on the proclined teeth, so part of the diagnosis was to actually make a temporary crowns. Spend the whole day here and removing all the previous restorations, and we did the diagnostics on the model, and so I was able to use in the model transform and improve the initial outcome, and you can see the smile with the diagnostic crowns in place.
It was look like a
That's right.
Rabbit or something.
Rabbit,
Whatever
okay.
you call it. I'm feeling great. It looks very nice now.
Been fantastic.
Thank you.
Thank you very much. Thank you. It's been about a week for the temporaries, or 2 weeks? How long?
It's 2 weeks.
It's 2 weeks.
Yeah.
Okay. Well, so how you feel with the temporaries?
I'm feeling okay, but I'm much more careful now what I eat. But people notice the difference. And
They have noticed the difference.
They just think that's the real.
That's right.
But they just commenting, and a lot of nice comments. So
Fabulous. My pleasure, my pleasure. With the crowns, we also had to make a little partial plate in between while we were planning for the implants for her. So at the end of the day, when implants were placed on the upper left side and upper right side, you probably don't know which is where. For this patient, that's the whole beauty of thinking in terms of aesthetics and function with a high smile line. We don't want to change the gum levels, etc., because it's very hard to do. So we have to graft sites to be able to allow the implants to be placed in the right position, so it emerges in the right level in the facial frame, so the teeth look right and the gums look even and the smile looks okay. All those things are sort of calculated as a part of the overall treatment planning and diagnosis. So what happened at the end of the day is that once the implants were integrated, I went ahead and made whole new temporary crowns on both the teeth and the implants. You probably can't tell which one's the teeth, which one's the implants in the temporary format where she's smiling in the video, in the final images. And that allowed me to redesign the smile again. You're probably looking at a smile you can see on the upper left side, teeth appear short, so we lengthened those teeth. We also gave a bit more front bulk, so we did more diagnostics in the mouth. And then you can see the final outcome where we have achieved very beautiful symmetry. Her lip looks right, the thickness and outline, the teeth belong to that lip frame. You can see all the individual little, we call it macro and micro aesthetic elements, which means that little characterizations and the shapes, little like serrated edges that we create, the enamel that makes the teeth look really, really natural. And then we look at the whole face, how to hold this smile line, all that porcelain work fits on the face. And that is what creates the whole dynamics of the aesthetics. Aesthetics is a dynamic format, right? You see, what happens is when someone talks to you, smiles, it's gonna look good. It has to fit that patient's face. You can't just look good when you're smiling like this or like that. It has to look good on different angles, the whole dynamics of the facial expressions. And you can see in the final video how beautiful my patient it looks, how the whole, we've complemented the whole the aesthetics of the patient's face. Those teeth belongs to that patient. And naturally in the future we will work on a lower arch and improve that, but it's not as visible. And so the attention was given to the upper arch to improve the whole smile, to improve this patient's confidence. And let me tell you, she loves smiling. This bubbly patient's personality is being complemented by her new beautiful smile. We've placed lots of implants and lots of crowns. Also, her own natural teeth are there, but you can never tell. And that is aesthetics.
I feel great, yeah, thanks a lot, and I can't stop smiling.
What about friends? What about you when you work?
I mean, everyone can see the differences, and they all said to me, "There's something different on your face. What's wrong?" I mean, when I told them that, "Oh wow, it's beautiful. Oh, it doesn't look like artificial. It looks."
Yeah, you got implants done, you got crowns done. You can't tell, can you?
No, you can't. They just think it's a natural my teeth, so which is a good compliment.
It is. It is.
And then it was about 6 months, 7 months waiting period, and the result is fantastic.
And I'm so happy for you.
I'm very happy for it, so thank you very much.
It's a pleasure. It's a pleasure. Thank you. Give me a big smile. Fantastic, fantastic, fantastic. And this treatment, if you in this category of complex care, can be also done for you as well.